Welcome to our free YouTube live stream webinar brought to you by Healthcare Training Leader. I'm thrilled you're here with us today because we're about to dive into something that can seriously boost your bottom line, plugging up revenue leaks to achieve a 99% clean claims rate. Today, we're cutting through the chaos and showing you the real solutions to seal those revenue leaks once and for all. And leading the charge, none other than the incredible Owen Dahl from Owen Dahl Consulting, a nationally recognized expert in practice management and revenue cycle optimization. This is your chance to get insider tips that you can take action on immediately. Now, before we jump in, do us a quick favor, hit that subscribe button so you never miss out on must-know updates on healthcare compliance, billing and coding, and everything in between. Also, we want to hear from you. Got a question? Drop it in the comments anytime. We're watching and we'll do our best to get it answered. Plus, here's a little bonus for our live viewers today. Comment "Clean Claim Now" below at any time during today's webinar, and we'll send you an exclusive discount on any Healthcare Training Leader product or service. Yep, just 2 words, Clean Claim, and the savings are yours. All right, ready to plug up those costly leaks and boost your clean claims rate to 99%? Let's go ahead and get started. Welcome, Owen.
Thank you very much, and I want to thank everyone for joining us today for what I guess we had some discussion about whether or not we dared to say 99% clean claims rate. And when I think about that, it's like, well, that's close to perfection. So I guess my challenge to you as a listener today, I've got a couple of challenges. One is, have you ever had a day that you've had 99% of your insurance claims go out clean? They've made it through the scrubber, they made it through the payer system, no denials, no appeals, or anything like that. So just to challenge you, have you ever had a day that's 99% clean? The second challenge is that there's really 2 goals in the process, at least that I have. So I'm going to turn this around and say, as you signed up for this session today, you had to have some goals in mind. So I want you to think about those goals that you have and say, okay, I want to watch for this, and this as ways of helping me achieve that 99% clean claim rate. So I think it's important there. And then another aspect of the goal statement is there are 2 different kinds of goals that we have. One is a learning goal, and the second one is a performance goal. So as we think about what we go through today, hopefully you'll learn some things, but also that you'll have some idea in mind as to what you can do to achieve that 99% clean claim rate. Our goal is to get you to do that. So our objective is we're really going to go through the entire revenue cycle process. We're going to look for some gaps, blockades, and redundancies. And looking at some wastes, and then hopefully I'll share some things that will help you, give you some thought and encourage you to think about the fix of the kinds of things that are ahead. So really we're kind of, when you're talking about a 99% clean claim rate, you really need to think about the entire process. And how and what you do relative to that and where we kind of go. So as we think about this, there's a whole bunch of it's $125 billion uncollected annually for poor billing. Now, that's a huge number. And I know each of you are contributing, so if there were 125 people on this call, each of you were contributing $1 billion each. No, I don't think so. But the idea is that there are a number of unpaid bills that are there, and that the concept is that it requires us to think about the idea of what we can do to fix our revenue cycle. So as we talk about today, we're going to talk about key performance indicators, time of visit, managing contracts, only two seconds on that, processing claims and managing denials and so on. And really the whole concept is that it starts with you, and that you as a member of the team, a leader of the team, have to really seriously look at what you can do and what your role is relative to fixing the cycle. So here's a basic flow chart. Now, I like to use flow charts because I like to use pictures as to how we go about this. So this is really divided into three sections. The top section is looking at the pre-encounter activity with the provider. And that can go anywhere from the appointment schedule, verification, to authorization if necessary, completing the registration, patient appearing in the office, etc., collecting the copays, deductibles. The middle part is really the key. I mean, the whole reason for us to exist is to have that provider encounter, that relationship with that patient, and then what the provider does in terms of completing the documentation relative to being able to submit it to the revenue cycle team, which is that bottom portion there. And you've all seen this concept, and you all live this concept basically. So this hopefully is a picture that helps you think about that. So again, part of the challenge is for you to look at this and say, maybe after today, you could come up with maybe 3 things that you feel like you could go back to the revenue cycle concept here and fix. So, and then, okay, so I said we're going to look at gaps and blockades and so on. Well, what about waste? What about kind of thing and concept of waste? So when we talk about from a revenue cycle point of view, what are wastes? Well, defects. What's defects? Missing information, wrong information. Where does that start? That starts potentially with that initial phone call. Overproduction. How many times do you move pieces of paper? How many times do you do things again and again and again? Waiting time. Well, we know in a clinic cycle, a patient revenues or patient cycle, visit cycle, that there's a lot of wait. But there's also wait in the concept of the revenue cycle, because you have to wait for the demographics, you have to wait for the charge capture, you have to wait for a lot of things like that. And what kind of delays are there with regard to that? Not only that are we talking about the patient direct visit, but we're also talking about those surgical cases, those procedure cases, and so on that go on. I'm going to skip the end for a minute. Transportation. Moving pieces of paper, the good old days when we had fax machines. Oh, we still have those, but the good old days when we had power forms and that sort of thing, moving those pieces of paper. How many of those pieces of paper are in process as we speak? If we look at each of your desks right now, how many claim forms or claim adjudication processes are waiting for activity to occur on your desk? And is that a normal amount, or could it be even greater? And then, searching for that data, searching for the documentation, and then excess work. But I skipped the end because what the end is really critical. And that is that we know that not one of you can solve the revenue cycle problem. Not one of you can handle all of the claims that go on in the practice all by yourself. So you need a team. And that means you need to engage the brains of the members of your team to help you today to what? Fix the revenue cycle. So it's really important to do that. So in order to do that, then, let's set the tone with some guidance. And there really are 2 policies that I like to think about relative to helping you move forward. Policy number 1 is the financial policy, which is for patients. And policy number 2 is the collection policy for staff. Well, what's the financial policy? Hopefully what that is how you communicate with the patient to let the patient know what their responsibilities are relative to the financial side of their clinic visit itself. So, they should see a form that identifies and outlines all kinds of detail, receive a copy of it, even have this posted on the website. So the financial policy content should be what is in this policy, the patient's responsibility for copays and deductibles, when payments are expected, fees for late payments, if any, discount options, if any, and that sort of thing. So this whole list here is really critical. So I would encourage you as step 1 in terms of trying to look at that 99% clean claim rate is that there's a clear communication and a clear understanding with the patient. So take a look at your financial policy, and this should be reviewed in December of every year, being prepared for that, inevitable deductible copay scenario that hits us in January. Now, the collection policy, what is that? That's what we're going to be talking about for the rest of the session with us today. And that is, these are the details and the guidelines that you will operate under that's based on that financial policy, but is also received from or developed concurrently with you and your leadership relative to what are the steps necessary? How do we go about this? How do we define a delinquent account, et cetera, et cetera, et cetera? And again, we'll be talking about that. So the rest of our session is to really define the collection policy that you may have. So what we have here is the idea of pre-registration. Well, what does pre-registration mean? That's that scheduling of the appointment. That's when that patient calls and says this. That's when that patient, and how do you handle that? And part of the issue that I have with that is I'm a new patient and I'm calling your office and I'm spending 20 minutes on the phone giving you my demographic and my insurance information, who my primary care provider is, whatever, as we go through. Well, as that time is there, is that a waste of time for you? Is that a waste of time for the patient? How do you handle eligibility? Meaning, is there verification of insurance coverage? Is that calling each payer one at a time? Is that not doing it at all? Is that using some automated process? What are you doing with that? And how effective is that? Because if you look at your denial rate will tell you how many eligibility issues or verification issues there are. So we have to think that through. And it's a good challenge for you to look at that denial rate to go back to what happens here. And then obviously, what are you doing for reminders and that sort of thing to make sure that the patient knows that their appointment is, and in some cases, to remind them of their copays and of their balance due, if there is such a thing that goes on. So at the registration, we're confirming all of that data that we've gotten. And frankly, at face-to-face, that's clearly the best time to collect. So what we want to do is we want to make sure that we're collecting everything that's possible to be collected for that patient visit, and so on. We're going to, and let's make sure it's, greet the patient, be as friendly and as cooperative as possible. Make sure you're aware of the old current balances that are there and what can be done. And then as you think this through, I kind of like this, will that be cash, check, or charge? It's not, you have a copay of $20. It's, you have a copay of $20. Will you be paying for that in cash, check, or with a charge card? In other words, what you're doing is you're getting away from a yes/no answer, and you're putting the patient on the spot to be able to say, yes, I will have to do that with. You can also, to take some of the pressure off of that front desk staff where they're having to collect it, you can eliminate some of this blame, if you will, or the difficulty that they have by simply saying, well, I'm sorry, it's not me that's asking this for you, but your insurance company requires that we collect copayments at the time of service. So if you want to talk about it with your insurance company, that's fine, but that's the $20, and that's the copays, or that, the deductibles and that sort of thing. Or you can blame it on your accountant. Say we have to be able to make sure that our accounts are taken care of. So please help me out, and so that I can be able to do that. Now, what's a leak? Well, in our publicity that we talked about, we suggested that there are leaks. Well, what are leaks? Well, a leak would be when something actually happens that never gets charged for. So the charge capture idea is really critical. Now, do you have that automated through your EMR that interfaces directly to your practice management system? So all you have to do is review it. You have to do data entry. And again, what am I doing here? I'm just talking about the things that you know and do every day. But I'm challenging you to think about how well is and how effective is our charge capture process for an office visit, for a surgical procedure done at an ambulatory surgery center or at the hospital, or a test that's done either in the office or somewhere else, a procedure that's done in the office. And when does this occur? Back to the delay of time. When is this, and the waiting that goes on? When do you get your charge captured data? Do you get it today? Do you get it tomorrow? Do you get it 2 weeks from now? Do you get it a month from now? And what kind of criteria do you want to have? So as you gather data here, this gives you the opportunity to go back to your leadership and say, we're finding that Dr. B doesn't get us even his office visit activity until the end of the week. So on Friday evening, we get all kinds of stuff from Dr. B. And if he would just do that on Monday, Tuesday, Wednesday, Thursday, Friday, our workload would be smoother. Everything would be really good. Our surgical procedures, Dr. C doesn't get our procedures done, and she's very reticent about completing that information. And sometimes it takes 3 weeks before we get that data. Now, what we also want you to do is a random audit. And when I say random, I don't mean auditing every single charge that occurs. What we want to talk about is making this random. So you might say every 10th chart, every other Wednesday for Dr. B, every other Tuesday for Dr. C, or once in a while, however you want to do it. But the idea is there should be some audit in the charge capture process to help you make sure you're moving forward with that. Then obviously you submit the claim because you got all the data. It goes through the clearinghouse, excuse me, and then you get the rejection report from the clearinghouse the following morning. Well, what's your rejection rate? Is your rejection rate 90%, 10%, 1%? Or did you have one of those days where you got a rejection rate of 0? Wouldn't that be amazing if we got a full week of 0? Then our clean claim rate at 99% would have a pretty good chance of being able to be achieved if we do that. So let's work that rejection report and see if we can reduce that percentage from X down to 0 or down to 1 as minimum as we possibly can. Then you get your remittance, your EFTs, your ERAs, and your copies of EOBs and that sort of thing. So you want to make sure that you're getting that data, but do you have a fee schedule by payer in your system so you know that they paid according to the terms of the contract that you have legitimately signed with the payer or not? And the concept here is do not post and go, meaning don't just sit there and make sure that it all got posted and then put it over here in the corner, because what happens there is we got another waste. That means we got a lot of work in progress that needs to be reviewed because probably 99% of your EFTs, or your ERAs or your EOBs have some form of an appeal, some form of denial, some form of not paying according to the contractual terms and that sort of thing. So we're taking a look at that to see what we can do and make sure that we move forward. And we're looking then at our adjustments and kind of how that fits. What's your plan of action for following up on insurance? Do you follow up at 30 days, 45 days, 15 days, 18 days on Medicare? What do you do in terms of making sure that there's follow-up that's occurring relative to this? Certainly a 30-day action plan is warranted in terms of taking a look every day or once Mondays for Blue Cross and Tuesdays for United or whatever you do. But the idea is making sure that you're managing those denials, or not at this point, we're not managing them. We're creating an awareness of the denial. We're creating an awareness of the need to appeal. And we're creating that work list or that task list that we need to have so that we make sure that those denials don't get forgotten. Part of the reason that there's $125 billion that's not collected is because we don't work the denials and we don't work the appeals that we really should be looking at and moving forward. So how about some key questions for you relative to this at this point in time? I mentioned the idea of not using your staff effectively as a potential waste. Well, how's your staff assignments for duties? I worked with one practice, which was a 9-doctor cardiology practice, that had each individual in the revenue cycle responsible for each doctor, not breaking it out by carrier, not breaking it out in some other fashion. So it's important for you to think about how do we assign staff duties, and then we look at is there cross training? What happens when somebody is out for a week for vacation? Something else happens. What are our aging reports telling you in terms of trends by payer, by provider? Is your denial review and resubmission process working? So these are just, at this point in time, just stop and say, I wonder if all of these questions are being managed effectively. So they really are no longer questions that I would have to ask, but they are things that I feel comfortable that are being looked at and are moving forward with, and how we go forward with that. So let's manage denials and appeals. And I talked a bit about this with your ERAs and your EOBs and so on. Take a look at your denials and your denial rate, and let's track it based upon what? Is it an internal source or an external source? Another reason why it's difficult to get to 99% is you may be perfect in your internal denials, but you always have a payer that's going to do something relative to what their demands are. I need more information. I need this. I need that, whatever it happens to be. So, it's important for you to think through and to be able to look at that denial report and identify how many of those are done internally by us. And what's a denial? What did I use as a word? Waste. The denial is a waste, meaning that it's a waste of time, that we should have done something initially to be able to prepare. That means charge capture, that means demographics, that means random audits, that means those kinds of things that needed to be done to help prevent denials from occurring. And that prevention can apply both to internal sources of information, but also external, because there could be patterns that your external source, your external payers are actually have a pattern that they deny claim with this CPT code or this ICD code or whatever it happens to be, so that you can identify a pattern about, about what's really going on. And so we need to then appeal all denials so that we can gather this data. And once again, we have this data that clears a pathway for you to be able to say, these are the things that need to be done to be able to help us in managing these denials effectively. So we're managing and looking at those trends by payer. Here's a list. From Medical Economics in July of 2020, they published this. And you could take this list, take a look at your denial report and say, how many of my denials are duplicate? How many of my denials relate to, patient ineligibility? I didn't do my verification right. Something went wrong there. Deductible not met, whatever it happens to be. Timely filing. Critical when we go back to when did your provider give you information? Now, that has nothing to do with the insurance company's timely filing, but it could have a lot to do with your own internal timely filing. So as you think through this list here, take a serious look at your denial list. Take a serious look at the output that you're getting from your ERAs and your EOBs, and make sure that you, in fact, are aware of what goes on. Now, it's one thing to know this and to have that data, but it's another thing to challenge you with, what are you going to do with it? How are you going to make this work? And how are you going to move forward with that? So let's leave the insurance piece for a second and talk about patient collections. Well, training that front desk. And boy, there are probably several jobs that I would not want to ever do in my life. One is I would never want to be a practice administrator again. Okay. But also I would never want to be a front desk staff member with all the responsibility that they have to greet the patient, get the collections, do this, do that, do this, do that, and so on. So a highly trained and a highly skilled front desk staff will do a lot to eliminate your denials and reduce problem issues and the back end, which will what? Save you time and save you significant dollars. Now, my friend Elizabeth Woodcock has this idea of an if not, why not report. And so I'm stealing it from her. But basically what she says is that the idea is that if you had 20 patients you were seeing today, and each of them had $20 copays, and 2 of them had $50 previous balances due, at the end of the day, you should have $500 collected. $20 times the 20 patients, and 2 at $50 adds up to $500. Well, if you didn't get that, then you'd ask the question, why not? And challenge your staff. Challenge that front desk to, again, not every day, but you can do this randomly. Just say, okay, I think I'm going to do this next Tuesday. Boom. If not, why not? If you didn't collect it, why didn't you collect it? Have a little log sheet and have them write a note on the right-hand side that says, I didn't collect it because whatever reason they gave you makes sense as to what goes on. We'll also want to talk a little bit about statements and the sequence, and we'll want to talk about the different things like that. But again, we talked about a 30-day follow-up on insurances. What kind of time frame do you have in terms of following up on cleaning up patient accounts and how these patient accounts are and what we need to do to look together to make them happen? So we're in the business of collecting money from the patient. Well, again, what's the best time to collect? As I said earlier, at the time of registration is the time the patient checks in and making sure that that copay or deductible or even previous balance is collected. The second best option is, again, personal interaction, and that relates to the use of the telephone. So as you think this through, what level should I suggest that our team and our collection policy sets the tone for when do we determine and pay for that or use the telephone as a way of collecting? Is it at $100? Certainly not going to be at $5. But there's a number somewhere in between there that would warrant the idea that anybody that has a balance due that's greater than X, they will get a phone call. And then you, again, using the phone and then having the ability to take credit cards over the phone, having the ability to encourage the patient to send a check or reminding the patient that, hey, you're coming in next week, bring this money in for, to take care of this balance that's due. So what you need to think about is how do I use the phone and what can I do and what is a good strategy to make that come together. You can also use your website. And, working with your bank or your internet vendor or somebody like that who says this is a secure way and it's a very secure process to be able to get that payment through your website. You can post your financial policy so that the patient is aware of what this responsibility they have, as we talked about before, and you can then look to ways to collect through your website. And I post your fees there. Well, why would I do that? Well, potentially, especially if you're a concierge practice or a direct pay practice, or if you're in a competitive environment where you've got a lot of private pay patients that are there, maybe you post your fees. Maybe you make them aware of the fact that there are discounts available for cash paying patients. You figure some things out, and how open you want to be on your website is entirely up to you based on what your market review is. But using electronic tools like the website to A, inform, and B, collect is really something that makes a lot of sense relative to where we want to go and how we want to do this. Now, aggressive or not? I love this question. So in your collection policy, what we want the leadership to do is to be able to tell you how aggressive your team should be relative to collecting the outstanding balances that are due. And when I say aggressive, Dr. A says, I want everything done possibly to make sure that every balance is collected because I did the work. They came here, they got the service. I deserve to be paid. Dr. B, on the other hand, she's a little bit more, well, yeah, I know, but they don't all have money and they don't have this and they don't have that. Well, what happens to you and your revenue cycle team in terms of dealing with that? And I use A and B. It could be a large group of doctors in each bucket. And those are extreme buckets of get everything you can, let it go. Okay. But somewhere in the middle, somehow or other, well, let me put it another way. Who's caught in the middle? You are. So do you have to train your staff that for every patient that Dr. B has, we don't do anything? For every patient that Dr. A has, we do everything. Well, if you've got 7 doctors and you've got 7 different positions, that's pretty difficult to do. That's why a collection policy makes sense, because that policy then gives you the guidelines that says things like, we will do this for a delinquent account. We will do this for collecting at the time of visit. We will do this for our telephone calls. We will have this on our website, different things like that that are important for you to have. So the aggressivity that you might have related to collecting is going to be built on and as a specific guidance from your leadership and how that leadership is suggesting. And then if the leadership is aware of this, then you can say what happened with, why didn't this get collected? What happened with that? Why we collected this, and so on. So you have the ability then with a good collection policy to be able to move forward with that. Now, payment plans. I'm a little reticent to recommend that you do payment plans. And the reason I do that is because they're very difficult to manage, number one. And number two, you're really the bank. So you're funding that payment plan and that issue that patient has. You'll need to, if you have certain situations, you'll need to say, we don't charge interest or we do charge interest. We do charge a collection fee. I'm running into a situation with a lot of the service providers that I have at my home where they're charging me the actual cost for the service, and then they're charging me 3% more if I use a credit card. So I'm having to pay a carrying charge with relationship to that. Now, do you want to do that? Do you have to do that? Certainly it's an option, but I throw that out thinking in terms of what options you might have to encourage payments, what options you may have in terms of the method of payment that you might receive. But be aware of the fact that there are federal guidelines. And one of the guidelines is that if you accept more than four or more payments in a payment plan, then what you have to do is you have to have a disclosure statement that's available to that patient that says we will not charge interest, we will not charge a carrying charge, but we would agree that you will make $40 a month payments for the next 6 months in terms of doing, complying with the need to eliminate the balance due. So there are things there, but basically, there's care credit. There's a lot of other options that are available to you. So you don't necessarily have to become the bank, if you will, to handle the payment plan concept and strategy that's there. And again, I think it's very difficult to manage any payment plan strategy because you've got a lot of other things that are hitting you on a daily basis relative to what goes on. Now, you can retain a copy of their credit card number and use that, again, with the full understanding of the patient. But the security that goes along with that is a big question. Who has access to your drawer with all of the credit card numbers in it? Hopefully it's not posted in some kind of a general file in your system. So you have to think through whether or not that's worthwhile in moving forward. So then still talking about the patient scenario, hopefully you're using a weekly kind of billing option. And when I say that, I still find practices that are sending out statements once a month on the 25th. What happens with that is you end up with about 8,000 phone calls that next week and then very few phone calls for the rest of the month. And you have such a burden then of trying to balance this. So we like to suggest that you do a weekly billing process, meaning once a week you send out about 25% of your statements. And what that works out to, and gives you the example, if on Monday you received a payment from a payment payer source and it still indicated that there was a patient balance of X. Well, say by Friday then, you send out statements every Friday. Well, then that patient pair, that AOB that says the balance was due, you flag that account to be into that cycle so that patient gets that bill then that week. And for 28 days later, gets it again. 28 days later, gets it again, and so on, so that there's some reasonable sequence. But if you do that for a quarter of your patients every week, then you'll have an even balance of phone calls and that sort of thing. And so you create then ways to write letters. Even today, emailing and texting is an option for communicating with patients as long as there's some level of confidentiality that you have. There's also some creative options that you can do in terms of sending these notices to the patient that says your account is past due. You can do things like send out let's take a birthday card form or an envelope and put a birthday notice on it, and on the first, as the patient opens it up, it says happy birthday. They open up the inside of the account and it says your account is now 90 days past due, so happy birthday. I mean, that's maybe a little silly, but the idea is that you can be a little bit more creative rather than just simply sending out statements that are computer generated that may or may not be opened by the patient or the patient's family and could simply be destroyed, thrown away, and all you've done is wasted time. So along that line, think about what is a delinquent account, and how do you define a delinquent account? Now, when I asked, if we were live and I was asking this, live meaning in person, and I was asking you this question, I would get answers anywhere from 90 days to 120 days, or it may be that in some cases it's delinquent immediately. So it should be paid. So it's, again, part of your collection policy is define what a delinquent account is. I kind of like two statements. And when I say two statements, if we go back to that statement billing cycle that I just talked about, that patient that got that statement gets that statement this week, that would be statement number one. Excuse me, that would be statement number one. 28 days from now, that would be statement number two. They would, if we don't receive payment within, say, 15 days after that statement, that patient then falls into the delinquent bucket, where we do letters, we do phone calls, we creative statements, we do all kinds of different things to make sure that we're doing everything we can to address that delinquent account. But again, part of your collection policy is what? Define what a delinquent account is, and how do we go about managing that? Now, another thing that I think is interesting is how much does it really cost you to collect your money? And when I say that, I look at it and I've got $8.75 for a statement. Well, if you look at that here and say, that's crazy. I spend 62 cents to send a statement electronically through my clearinghouse. I don't believe it's $8.75. Well, think of it in a different way. And that is that you're occupying space in your hardware, your software. You've got staff that's reviewing that account on a routine basis. You've got a number of issues that require what? Resources to manage those statements and manage those delinquent accounts. So if you're really getting down into, well, what can we do more efficiently? We can be more efficient with that statement process. Now, I've got $25 listed here for denials and appeals, and I've seen ranges anywhere from 15 to 40. So let's just say that it costs you money every time you manage a denial. Well, are you, again, writing out a check for $25? Are you writing out a check for $8.75 for every statement sent? No. What happens is the resources that is being applied to managing that denial, making that appeal, is roughly a cost of $25. So as you think this through, and you're talking about a denial. They could take a denial on a $75 Medicare allowable for a 99213. That's $25, which is what? 1/3 of the cost or of the income that could have been received from that total payment had we done it correctly. So there's a lot of need for us to think through the denial, appeal, and the benefit process that goes on with regard to what we do in terms of managing that, what we do in terms of how much time it takes, the delay in cash, and so on. So we're looking for ways that we can help develop the staff so that they have better knowledge to what? Eliminate the denials, reduce the number of statements that are being sent. And by the way, the statement at that kind of cost, hopefully you have your system set up so that a patient receives, say, one statement for a $10 balance and no more than that. Why? Because of the cost of processing that statement. You don't write that little small balance off, or you could and make it out of the system, but flag it so that the next time the patient comes in, that the front desk is aware that there's a written off balance of $7.50 that is still due from a visit 6 months ago, and that needs to be paid. So we're looking at that to see where we go. Now, I mentioned earlier the idea of your staff and who's responsible for what, making sure that we're doing that. But I really want to encourage you that hopefully, in a lot of these cases with you who are participating in this webinar today, it's not just one person. There might be several people who are part of your team that are listening to what we're talking about. Well, take advantage of this time then to what? Talk about it. Have everybody think about it. Have everybody engage their brains and say, well, gee, if I did this differently, if you did that differently, if we did this together, however it would work, then what we're talking about is helping you as a leader, or helping each of you improve your performance, which does what? It improves our cash management situation all the way through. So I think it's really, 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 really important to develop the staff and make sure that the staff is accountable. And I've highlighted on this slide, use their brains. By being accountable, you can say to everybody, not only do you have to do this job because this is an important thing for you and we appreciate the efforts you put forth to do that, but you not only do you have to do that, but you got to help me. You're the one that does the work. In Lean Six Sigma, we call that the process owner. That's the one that actually does the work. And those that do the work are the ones that are more likely than not able to help us get better ideas and better ways to come up with how we can do this better and how we can move forward. So holding you and each of you accountable for not only then accomplishing what your job description is asking you to do, but holding you accountable for being able to say, I wanted to contribute my knowledge base to the success of our organization and how we could move forward with that. So key performance indicators, hopefully you've got some concept of your metrics, and what you're looking for is some baseline, some knowledge that you have. Hopefully you're communicating this with your doctors. And the three real key performance indicators in the revenue cycle, there are several others, but the three key ones are days in accounts receivable, net collectible percentage, and accounts over 120 days. Now, the first two require a little bit of calculation. So what's days in accounts receivable, or days in services outstanding? So it's a DAR, DSO, whatever label you put on it. But what is your days in accounts receivable? All that is your total accounts receivable divided by an average number of daily charges. So if you looked at the last 90 days of production for your entire practice and came up with X dollars, okay, we came up with $90,000. And so with $90,000, 90 days, that means that my average daily charge was $1,000. Well, my outstanding accounts receivable is $70,000. Well, divide 1 into 70,000, that means that your days outstanding of receivables is 70. Well, that seems pretty high. And I know I gave you some very simple numbers only because that's what my math will allow me to do. But what's your goal here? Get your days of accounts receivable calculation to be 30 days or less. A long time ago, we were happy with 45, but with electronic submissions of ERAs, EFTs, claim submission, and so on, we can get that number down. And I work with a number of practices that are managing to stay below 30 days on a routine basis. Now, the net collectible percentage, what that is another calculation. But what we're looking for here is your overall charges minus your adjustments, and your adjustments based on what? Based on your contract rates that you have. So if you have contractual adjustment with Blue Cross, a contractual adjustment with Medicare, a contractual adjustment with United, et cetera, means you can't ever collect that billed charge. But you should be able to collect whatever that negotiated rate is that's there. And so you'll want to look at that and say, what are my adjustments? And why do I have an adjustment of, clean or of timely filing? Why do I have an adjustment of this? Why do I have an adjustment of that? So it's important for us to be able to know what goes on. Your goal with net collections, meaning of all the potential dollars that you could collect, private pay, 100% of billed charges, insurance companies, 50% of billed charges, whatever it happens to be. I know that of all the money that I potentially collected, how much have I gotten? And the goal is greater than 95%. That means that you would have a 5% or less bad debt rate. Then the third number that I'm interested in is just simply looking at your trial balance and looking at your 30, 60, 90, 120, 150, 180 day buckets. And what I want to do is I want to find out how many of my accounts in total, what's the percentage of my total outstanding accounts receivable that are greater than 120 days. I want to get that down in that area of 10%. And I want to get that down without just arbitrarily writing everything off so I always look good. I want to get that down based on the fact that we've actually worked the accounts and that we continue to work really hard to do that. So here's a good question. What are you doing wrong? What can you do differently? Go back to that flow chart. Go back to identifying what the causes are for the problems. Ask a simple question. Why? Why did this happen? Or why do you do it this way? And then drill down by asking that same, why do you do it this way? Well, it's because that's what I was taught. Well, why were you taught that? Well, because that's what Jane said that had to be done. Then you say, who the heck is Jane? Well, Jane left 20 years ago. So who knows? We're doing one of my favorite acronyms is that TW squared ADI, which is the way we've always done it. It's time for you to take this information that we're talking about and time for you to be challenged with reviewing and doing your own audit of your own billing process to take a look at this TW squared ADI and eliminate it and be able to move forward with doing things differently. Now, I'm not going to spend any time to any great extent anyhow on value-based care, but value-based care is our future. So as you're thinking about revising your collection policy, as you're thinking about taking a look at how things go, you have to remember and look at your value-based care contracts as well as your more traditional managed care contracts. And what payment incentives are there? What transparency is there? What are the benefits of the quality, efficiency, safety, and cost aspects? So what are the rewards that you get? So it's not only then understanding the collection process and the claim submission process, it's also being aware of the rewards or the consequences that you could receive or that your practice could be facing with regard to where that goes. So in monthly reporting, be consistent. Key there. And be consistent by utilizing dashboards and that you're sharing that same information to your providers all the way across the board so that they're aware of and that they're seeing the same kind of information as they go forward on a daily basis. We want to make sure that you're consistently reporting the data and the status of everything that goes on. So what do you need to do? Monitor activity and the resources used. Look at the results of your effort. Well, when you say monitoring, hopefully you go back to those key performance indicators. Hopefully you look at your denial rates, your appeal rates, and so on. And what you do is you use your current look. If you haven't done this before, you use your current look and develop a baseline that says, these are my key performance indicators, this is my denial rate, and that sort of thing. And what can I do to improve my revenue cycle in terms of where we want to go? So you want to know what goes on and develop that plan and moving forward with that. So a lot of times you see information that says, well, what's the best practice? Well, I don't want to go with best practice. I want to go with next practice. So what we want to do is we want to set standards that are appropriate, recognize and reward when things are done on the part of the staff, recognize what is going on in terms of their contribution to your overall success, meeting those performance standards, those key performance indicators, and exceeding those benchmarks, those baseline kinds of things, holding yourself and your staff accountable for what goes on, and establishing and adhering to a code of conduct. Well, what does that mean? Well, we have a mission, we have a value. We have a mission in our practice to make sure that that patient experience is as optimal as it possibly can. That's not only that interaction with the provider, that's the interaction with the revenue cycle staff. How many of you would like to have your patient satisfaction surveys come back that says my provider was great, but the revenue cycle team was not? How many of you get that kind of information? And that's kind of scary. So what we're really looking for is that we adhere to the mission and values. We adhere to the idea of being successful. We adhere to the idea of complying with all the rules and regulations so that we don't have any fraudulent billing options or scenarios that could come back at us. We have a culture of high quality, effective healthcare and efficient business practices that will help us move forward with where we want to go and how we might make the best move that we possibly can.
And that brings us to the end of today's powerful session, Plug Up Revenue Leaks to Achieve a 99% Clean Claims Rate. We want to send a huge thank you to our expert presenter, Owen Dahl from Owen Dahl Consulting. Your insights into streamlining claims, reducing denials, and maximizing revenue have been absolutely invaluable. Thank you, Owen. And of course, a big thank you to you, our amazing audience, for tuning in, participating, and committing to improving your claims process. We know your time is valuable, and we're so glad you chose to spend it with us. Before you go, don't forget, if you comment Clean Claim at any time during this webinar, you'll get access to an exclusive discount on any healthcare training leader product or service. Whether you're looking for tools to improve compliance, master billing and coding, or train your team on the latest regulations, we've got your back. Also, make sure you subscribe to the Healthcare Training Leader YouTube channel. We're constantly dropping new content to help you stay ahead of the curve with the healthcare compliance, billing and coding tips, revenue cycle management training, and so much more. Thanks again for being here. Here's to cleaner claims, fewer denials, and a stronger bottom line. We'll see you next time. And until then, keep those claims clean. Bye for now, and don't forget to comment Clean Claim for that special discount.